Hey you guys, welcome back. As promised, I have just a few questions on murmurs to test your knowledge really briefly and allow you to apply what I have gone over to try to help this be a bit easier when you are preparing for boards. Okay. Um, I know there's more, but I like to design these to hit the highlights so that you can easily identify them to be successful on exams as well as on boards. Okay. And like I said, there's a murmur video, and I just did one on mitral valve prolapse as requested. Okay. So let's get into these questions. But as always, I like to give my disclaimer for those of you who have been following along using my resources. Hey, y'all. For those of you who are new to me, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and founder and CEO of the Nursing Studio. I do these videos to help nurses and nurse practitioners, as well as other resources, to help them on boards as well as in practice. I always explain one versus the other as guidelines may vary as the test update. And you know that we treat patients on a patient by patient basis. There's no absolutes in medicines. So treat this material as such. Again, I know there's so much more to murmurs, but when you're preparing for boards, you need to be able to use all of that information that you have in your mind to be able to quickly apply that. So you take your knowledge, and then the next step is learning how to apply, right? So here are quick application tips when you are encountering murmur questions. I went over those in my video, but this is just to test your knowledge on it, okay? So the first question states a 47-year-old female presents to the office today for her annual exam. She has a history of hypertension, asthma, and diabetes. While assessing the patient, a diastolic murmur is noted at the base of the heart. What murmur should the nurse practitioner document? Is it A, mitral regurgitation, B, mitral stenosis, C, aortic regurgitation, or D, aortic stenosis? Take a moment and tell me what you think in the comments. All right, you guys, I always tell y'all to read the stem of the question first. That ensures that you are answering what they are even asking you. It makes you slow down and really pay attention to what's being asked. So the stem of the question states, what murmur should the nurse practitioner document? So, of course, we're looking back to see what has been noted and what potential murmurs we're seeing based off of the information, right? So the patient has a history of hypertension, asthma, diabetes. This is a diastolic murmur. So it says while assessing the patient, a diastolic murmur is noted at the base of the heart. So, I always tell you guys when you are quickly identifying murmurs on exam, boards, etc., they're going to let you know systolic versus diastolic. You always want to know one versus the other, and then the location, and you'll be able to quickly get these answers. So here's a diastolic murmur. So thinking about your diastolics, I do my Britney's Brilliance mnemonic of sassy systolic. Men really are stupid, right? So men really, mitral regurg, are stupid, aortic stenosis. And then diastolic is the opposite. So we know that we can eliminate A of mitral regurg and D, aortic stenosis, because those are systolic murmurs. So um, our diastolic murmurs that are listed here are our mitral stenosis and aortic regurgitation. So then you want to look at where is it located? They say at the base of the heart. Is mitral or aortic located at the base? And it is aortic, right? So the answer is C, aortic regurgitation, because mitral is lower. I know base makes us think that it's at the bottom, but the base is higher than the apex of the heart, right? So again, answer is C, aortic regurgitation. Next question. A systolic murmur is noted at the fifth intercostal space, mid-clavicular line. Radiation to the axilla has been documented. Which murmur should be diagnosed? Is it A, mitral regurg, B, mitral stenosis, C, aortic regurgitation, or D, aortic stenosis? Take a moment and tell me what you think. All right, reading that stem of the question first. Which murmur should be diagnosed? So they told us it's at the fifth intercostal space, mid-clavicular line. It's a systolic murmur, so we know that's men really, mitral regurgitation, or whatever mnemonic you use, says there's so many with murmurs. Use which one works for you. But men really are stupid with sassy systolic. So MR, mitral regurg, and aortic stenosis. So we know it should be either A or D, right? We can eliminate B and C because those are diastolic murmurs. Now, this is letting us know it is at the fifth intercostal space, mid-clavicular line. You need to know again where our mitral and aortic valve locations are, right? So, mitral is fifth intercostal space, mid-clavicular line, right? So, here the answer choice is A, mitral regurgitation. Number 3, a 68-year-old male presents for a physical. He complains of shortness of breath. On exam, lungs are clear, mid-systolic click auscultated at the apex of the heart. Based on these findings, what type of murmur should the nurse practitioner diagnose? Is it A, mitral regurgitation, B, aortic stenosis, C, mitral valve prolapse, or D, aortic regurgitation? Take a moment and tell me what you think. All right, you guys. So, I always say read the stem of the question first. So, based on these findings, what type of murmur should the nurse practitioner diagnose? So, what do we have here? The patient came in. They're complaining of shortness of breath. Their lung sounds are clear. A mid-systolic click was auscultated at the apex of the heart. So, all right. So we know it's systolic. So we'll take it back to those systolic murmurs. Um, but I always tell you guys also to pay attention to key identifiers in all questions. So it's telling us it's mid-systolic, right? It's at the apex of the heart. Apex is lower than the base of the heart, right? So we know it's mitral. So it's going to either be A or C because it's mitral, right? And in this situation, it could be mitral regurgitation as well as mitral valve prolapse because those are both systolic murmur still. But the way that we differentiate here is because they let you know it was mid systolic and a click heard, right? That is classic identifier for mitral valve prolapse, right? Now, mitral valve prolapse, as I discussed in that video, it can lead to mitral regurgitation, but that's a whole nother story for another day that I can do a question like that to kind of gear your mind on that. But you need to be able to identify quickly when you see mid-systolic click that you know that it is mitral valve prolapse on boards, okay? Again, I know in practice there's so much more deeper and things may be different patient by patient, but for testing purposes, if you see those key identifiers, don't sit here and make careless errors and miss things that you know and miss the obvious. All right. All right. So next, a nurse practitioner student notices a diastolic murmur while assessing her patient. She informed her preceptor that she heard the murmur at the fifth intercostal space, mid-clavicular line. She is asking what type of murmur, which murmur is the best answer. Is it A, mitral regurgitation, B, aortic stenosis, C, aortic regurgitation, or D, mitral stenosis? All right, take a moment and tell me what you think for this last question. All right, so stem of the question states, she's asking what type of murmur, so which murmur is the best answer. So this MP student has noticed a diastolic murmur, and she states that it was heard at the fifth intercostal space, mid-clavicular line. As we have discussed on all the other questions, fifth intercostal space, mid-clavicular line, we know this is going to be mitral, right? So we can narrow it down to A and D, mitral regurgitation and mitral stenosis. It lets us know that this is a diastolic murmur. Which one is diastolic? Mitral stenosis, right? Because men really are stupid. So mitral regurgitation is our sassy systolic, right? So we can eliminate that one. The answer choice here is D, mitral stenosis. All right. Like I said, I just wanted to give you a few of these so that you can see it in that fashion. Of the various styles of how to apply that for murmurs. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here for our next video. Bye, y'all.